Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Medical Group live stream, coming at you today live at 4:30 on this Monday afternoon. You may notice that Dr. Gwen's name is here, but he's not here. And the reason I'm leaving my name up there is so you can see the social there, the Dr. Vaughn spelled that way with no space. That's where you're going to look for my song that gets released on Spotify and all the streaming services May 25th. So that's why I put that up there. I'll try to leave it up for a lot of the show in case you want to refer to that. And of course, this is the third show without Dr. Gwen. So please write him lots of hate mail to let him know that he's supposed to be here. He will be next week. On Friday, I asked him, because I said he would be here this week, but Friday I asked him for sure, and he said, yes, I'll be there. Another thing that's kind of unique about next week is that may very well be the very last show we do from this studio. We're moving downstairs to another location. All the internet's set up. We're just going to move the lights down. The set will look a little different. It might sound a little different until we get all set up, but we'll be able to have the show down there so that we can use this for offices for PAs because we're growing here at the Auburn Medical Group and having to see more patients, and they got kicked out of their room, which now is an exam room, so we can give up the studio so they can use that. Thankfully, you have space downstairs. We do have people in the chat already. We have Jeannie Kissinger, who is saying hello. There she is. And then we also have Lizzie, who's asking a question. So this show is dedicated to the viewers who are chatting in. And Lizzie has something to say here. Lizzie is asking, what are the most effective treatments for a person that suffers daily migraines? So that is something we can talk about. Daily migraines, which is a horrible, horrible thing to have. And quite often we would actually refer to a neurologist for something that's that severe. So if it's been diagnosed as migraine, typically what we'll do is when somebody says they're having it daily, the first thing I think of is there something causing this? And could it be a daily rebound migraine to some kind of a medicine that's being used for it? And we have seen rebound, meaning you take the medicine, and then if you don't take the medicine and your body's used to having it at a certain time, like daily, then as it wears off from the day before and it's time for it again, you have the very problem that you were treating with the medicine. And that happens with headaches, with Tylenol, non-steroidal anti-inflammatory medicines like the ibuprofen or naproxen, and with the, I was going to say statin, not statin, the triptans, the medications that are used either by injection or by pill or nasal spray for migraine treatment, usually as an abortive treatment. When I say abortive, I mean you take the medicine right as you feel the migraine coming on, and it aborts the process because migraine is actually a process of a change over time in the biochemical environment of the brain, and it's a different thing going on when it starts than it is when it gets really severe. So that's why you can, stop it or abort it when it first comes on, so that you don't have to have the painful part of it. And some medications just aren't effective once you reach that really bad point. And so that's why when people have the medicines like the triptans, we encourage them, please, if you feel it coming on, take it early. Don't wait too long because it may not be effective. We also have a comment from, of course, Lindsay Antwine, and we always want to honor Lindsay Antwine, say her name especially because she is a big part of bringing this program to you and also bringing Dutch Brothers to us. So Lindsay, oh my goodness, Lindsay with another super chat. Oh my goodness, this is wonderful. We cracked the 300K mark. Yes, we did. Lindsay's referring to the subscribers to the Auburn Medical Group channel, which now exceeds 300,000 subscribers. It was at 100. Oh, this finger here. Can I do this? This right here on the wall behind me, the silver play button from YouTube. That was given to us by YouTube when we reached 100,000 subscribers. And now we've reached 300,000. There's not a special thing to put on the wall for 300,000. It's not until you get 1 million that there's 1 million viewers that you get to put up a bigger plaque on the wall that has a gold play button. So yes, it would be wonderful to reach 1 million. I'd love to see that happen. At the rate we're going, it's going to be way in the future. But, you know, the show may take off, and that's fine with us if people suddenly get interested in medical topics. When we had the rapid growth, it was when we were doing the regular procedure videos, which I would think almost everybody watching this program knows about our pre-produced procedure videos, meaning they weren't done live. And these will be things like the Dr. Pimple Popper type things with the dilated pore of Weiner. We have a really good dilated pore of Weiner. And then also a lot of earwax removal was popular back when we were doing those regularly. We're not doing those now. It takes a lot of work to put those out, and we kind of feel like everything that we were doing as far as education of the public and health matters had kind of been done with those type of videos. Maybe some kind of a unique situation comes up, we'll do another one. Again, Lindsay, thank you. Thank you for the super chat, and thank you also for noticing that we had hit the 300,000. We also have Lindsay, of course, giving greetings to Lizzie, giving greetings to Lindsay. And then Lindsay says it's going to happen, keep the faith, referring, of course, to getting to 300,000 subscribers. And let's see how far down this goes here. Of course, the kisses from Lizzie. Thank you. We appreciate seeing that. Let me know. Actually, you can't let me know. You'd tell me through the chat if we had something else coming up. And Lizzie's shooting for 1 million subscribers. So we could back up a little bit now that we certainly made notice of the super chat, and we do like that. Lizzie was asking about most effective treatments for a person that suffers daily migraine. So we covered the possibility of it being from a rebound reaction to a medicine that's actually used to treat it. One of the things that I don't see it now, but there was a time when people would ask for refills on triptans, and I'd noticed that they would be getting more than 20 a month or 60 in a 90-day period. And that's too much. If you're giving that much, you're actually going to cause there to be a rebound migraine or rebound headache occurring when the body is just so used to it. And so we'll encourage people in our practice to try to rotate, do a different treatment each time one of the new migraine comes on, instead of doing the same thing every day. And that way the body doesn't get as dependent on it. And the hope is that will result in them not having to take something that often, that they won't have that rebound anymore, and they'll be able to get out of it after hopefully just a few weeks of doing that. Okay, another comment. Lizzie's asking, what if the migraines are from menopause? Is treatment any different? Of course, with menopause, there's the possibility of considering treatment with hormone replacement, which may actually take care of it, since it's probably related to that. Just like many migraines are hormonally controlled with birth control pills before menopause. Now, not everybody can go on hormone treatment after menopause, and there are other treatments also unique to the situation of losing the hormones at menopause. But that would have to be determined for each individual patient, because not everybody is eligible or should have hormones given after menopause. Some people have risk for cancers. That's the main one. People who don't have, or people who do have an intact uterus, meaning they didn't have a hysterectomy at some point, they should not have just estrogens given. They should have estrogens given with progesterone. I know that a lot of people will give the vaginal cream estrogens or topical estrogens and not worry as much about needing to have that progesterone with it, or they'll give it as just a pill you take, maybe not even daily, just to have the influence of the progesterone to protect. Okay, I'm caught up on the comments and questions. Again, for those who got here a little later, we've had a little discussion about migraine, and we can continue to talk about that unless there's other questions or comments coming from the chat during this live program. I also want to draw attention again to Dr. Vaughn, because come May 25th, the song How Are We Going to Say Goodbye will be available on Spotify under the artist name Dr. Vaughn. It'll also be on Apple Music and YouTube Music, I believe. The other ones, I can't remember the name of them. Pandora is another one. So it's supposed to be on all the major streaming services, and it will be performed at the Fig Tree in Roseville, May 25th, sometime between 6 o'clock and 9 o'clock during their open mic night there. Oh, Lindsay's asking. Let's go back to Lindsay here. Lindsay's asking, does progesterone lower anxiety? Can it? Without looking it up, I would not be able to give you an answer to that. I do not know of that to be a thing that progesterone provides. It could be. I just don't know off the top of my head. And then also Lizzie asked, agreeing that that's a great question. Thank you, Lizzie, for throwing in your 2 cents there. So also, update, Dr. Gwaine told me Friday he will be back next week, and it will be our last show in this studio before moving on to the downstairs studio, so this can be used for more office space for our growing practice. So I want to thank you for participating in our live chat this Monday. We look forward to getting Dr. Gwaine back, and we thank Lindsay Antwine for making this possible. Until next time, this is Dr. Mark Bond telling all of you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.